The topic of our final project is reducing patient stress and cognitive decline. Our abstract here is assessing the cognitive decline in the elderly population, which is an ongoing concern, and there are various treatments and prevention plans out here, but here we will discover which interventions actually work. Our objectives are the following. We want to address the causes for cognitive decline and stress in patients with dementia during their stay in the acute care setting. And we also want to pinpoint some nursing interventions that will help to achieve a sense of normalcy, improve continuity of care, and promote calmness and rest for the patient. In recent years, the number of hospitalized patients with dementia has increased, although 25% of these patients are not actually formally diagnosed with dementia. We know that dementia alters how a person responds to their environment. They can easily become angry and frustrated because they cannot follow what is going on. Noise, conversations, crowds, and activities can be overstimulating for them and make it even more difficult for them to process or understand information. They also rely on others for emotional cues. If we are anxious and worried, they most likely will become anxious and worried also. There are many risk factors that lie here that do contribute to the decrease in cognitive decline and increase the stress the patient experiences. One of those risk factors are medications, because we do give many medications while the patient is in an acute care setting. The three main categories here are benzodiazepines, anticholinergics, and opiates. Benzodiazepines are approved and they can be a very effective medication regimen, but some cognitive risks exist. These include incident dementia, and also it can impair their new memory formation and cause complete anterograde amnesia. These unpleasant side effects can happen to anyone, but it especially occurs when these older patients are not already taking these medications at home, and we prescribe them while they're in the hospital. Anticholinergics, another major category here. This medication depletes the brain store of acetylcholine. This chemical is very important to our brain. It helps to promote memory and thinking. Again, unless the patient is already taking this medication, the likelihood that they would have unpleasant side effects is very high. Opioids. We give a lot of pain medication in the hospitals because the patients are experiencing new symptoms. They may have injuries. They may have had surgery. The list goes on and on. And we do know that opioids can cause major signs and symptoms and side effects in our older population, including excessive sedation, mental clouding, confusion, respiratory distress, visual impairment, loss of attention span, and loss of coordination. As our body ages, the way we metabolize and process medications is different. As the kidneys and liver age, filtering out the drug is not as efficient. This causes the medication to remain in the body and bloodstream longer. So not only are these patients going to experience these side effects, but more than likely they're going to experience them for even longer than a younger patient would. Another risk factor here is metabolic imbalances. Hyponatremia, hypercalcemia, and hyperglycemia. Hyponatremia can cause attention deficits, gait disturbances, and cognitive impairment. Hypercalcemia can cause depression, memory loss, and irritability. Low and high blood sugar can cause various symptoms, but some of those really important ones here are memory deficits, problems with information processing, and also problems with psychomotor functioning. Infection, urinary tract infections, and pneumonia, a very large topic amongst this patient population. As a person's immune system becomes dysfunctional in the older adult, these things can happen, and they are very common. When an infection invades the body, the immune dysfunction leads to an inflammatory response, which will drive cognitive decline here. We do know that one of the usual first signs that a patient has an infection in this population is a change in their orientation and cognitive status. Change in environment. Overnight hospital stays can contribute to cognitive decline or worsening cognition. The patient becomes easily disoriented. They're in an unfamiliar environment, unfamiliar lighting, the furniture's different, the room is different, there's individuals coming in and out that they do not know, they're not around their usual stuff, they're not around their usual people. This could cause major disorientation in this population. Sleep deprivation. It's a very common saying that you don't go to the hospital to get any rest. Patients develop sleep deprivation due to anxiety and stress. They're uncomfortable, they're in pain, they're away from home. This can lead to hallucinations and delirium. Patients' normal activities are interrupted. They have visits from doctors, nurses, techs, phlebotomists, environmental service, food, throughout all hours of the day and night. The environment can be very chaotic and overstimulating and overwhelming and scary. These issues can even remain after discharge. For an older adult patient, an overnight stay, short-term stay, or even a long-term stay can bring new health issues and disabilities. Since hospital patients are typically bedridden for much of the day, or they are confined to a four-room wall with no or little access to the world, they become disoriented, confused, physically weaker, and less able to resume their daily routine even after discharge when they go home. This means that once the patients are discharged, they are less able to care for themselves. The psychological effect of that helplessness can be very profound, not only to the patient but to their families as well. So what can we do about it? What as nurses can implement here to achieve a sense of normalcy, improve continuity of care, and promote calmness and rest for the patient with dementia? A wonderful tool that we have access to is the Nursing Delirium Screening Scale. This scale is used in inpatient facilities using 5 different assessments to determine if a patient is at risk for or starting to have cognitive decline. The factors that the scale uses to determine the risk for decline is disorientation, inappropriate words or movements, inappropriate communication, hallucinations, and delayed responsiveness. The higher the scale, the more at risk the patient is for having or developing cognitive decline, a very wonderful preventative scale that we can use before there even is an issue. We need to help the patient by reducing agitation and stress. A non-pharmacological intervention that we can use is aromatherapy. We can do this in conjunction with calming music, and this can help to decrease agitation, aggression, stress, and anxiety in these patients. We have protocols in place that we can use the aromatherapy, and this can help with headaches, relaxation, nausea, pain. We can also experiment with reflexology, which is defined as applying gentle pressure on certain areas on the hands and feet to produce beneficial effects on the body. We need to identify pre-existing risk factors. Patients with existing cognitive decline may experience increased confusion and stress, especially in the evening hours. This could be sundowner syndrome. They may already experience intermittent confusion throughout the day, especially if they have a history of stroke, TIA, TBI, if they have a history of hospital delirium already, or if they're a wanderer at home. This could be due to fatigue from all of the daytime activities, sickness, not feeling well, various lighting, and all of the new environment and situations and people. This puts the patient at risk for falls as well as other injuries or harm. They may pull out catheters or IV lines. They could even attempt to hurt themselves or staff. Something we can do here is to help create a contrast between day and nighttime. We can use brighter lighting during the daytime and low lighting in the evening. We can encourage calming activities such as music in the afternoon and evenings to help them unwind. And we can minimize environmental stimuli by keeping noises down in the hallway, keep the TV volume down during the day and off at night. This can help to provide a pleasant and calm environment to help the patient transition from day to nighttime. We also need to help the patient establish a routine. We need to identify immediately when the patient is uncomfortable, if they're wet, hungry, or in pain, offer to take them to the restroom frequently. They may be looking for family members or sentimental items, and we need to redirect and address those right away. We can also put into place stop signs in places where the patient should not go. We can declutter pathways and allow the patient to walk while being monitored in order to remain safe. Walking is great exercise and can help to release tension, which may help the patient actually relax and then rest. We can also use verbal cues and devices such as large and easy to read clocks and calendars so that the patient is oriented to what day it is and the time. We can write out schedules and to-do lists. We can also help the patient here by ensuring that we have proper glycemic control. One study states that light intensity exercise will help to regulate blood sugar, which will ultimately protect the brain and decrease the chance of cognitive decline. High blood sugar can reduce cerebral glucose metabolism, which will damage brain cells. Repeated exposure to hypoglycemic events can actually put the patient at an increased risk for dementia. For this, we need to make sure that we are monitoring their blood glucose levels as ordered by the physician and report abnormal findings as well as any trends that we see. Instruct the patient and family members on proper diet and exercise, what medications they're on, signs and symptoms of high and low blood sugar, and the meanings of their labs. We can also request an order for PT and OT to help ensure the patient achieves that light intensity exercise daily. This not only will help to promote proper glycemic control, but it'll also hopefully help them get restful sleep while they're in the acute care setting. While being in the hospital, it's very important to prevent infection due to it causing an onset of confusion and delirium in these patients. One of the main causes of infection in the hospital setting is urinary catheter-associated infections. 75% of UTIs that occur in the hospital are related to urinary catheters. To prevent these infections, the nurse could implement a PureWick urinary system. This is an external urinary system that allows the urine to be collected through suction versus an indwelling urinary catheter. This will help to keep the patient clean and dry and prevent placing that foreign urinary catheter that puts them at a higher risk for infection. That is the end of our final project. I hope that you all enjoyed and possibly learned something, and thank you very much for your time.